This presentation is about summative OSCE scoring. What are OSCEs and how are they scored? At CMSRU, we use standardized patient experiences for both formative and summative assessment. Standardized patients, or SPs, are actors who play the part of patients so that students can have the experience of interacting with patients in a safe educational setting. Seeing one patient is called an SP encounter. Seeing multiple patients with additional exercises between encounters is called an objective structured clinical examination, OSCE for short. This is the format that is used in the USMLE Step 2 Clinical Skills Examination. CMSRU students experience both SP encounters and OSCEs at different points in the assessment plan. OSCEs are summative assessments and are listed on the M1, M2, and M3 exam schedules. Before each experience, the CMSRU Simulation and Clinical Skills Center team orients students on the process and procedures that go into completing an SP encounter or OSCE. In years 1 through 3 at CMSRU, students are assessed with an end-of-year summative OSCE. As mentioned earlier, CMSRU summative OSCEs mirror the USMLE Step 2 Clinical Skills Examination format. Though the number of stations varies by year, the scoring for all end-of-year summative OSCEs remains basically the same. Each of CMSRU's summative OSCEs consists of different domains. In the M1 year, the domains are history taking, physical examination, and interpersonal skills. In the M2 and M3 year, data documentation or note writing is the added domain. Each domain has its own checklist. As mentioned earlier, an OSCE contains multiple cases or stations. For each station, there is a checklist of clinical encounter items that students must demonstrate, ask the patient, or perform on the patient. Even though the domains are the same from case to case, items are different for each encounter and are related to that specific case. For example, if case 1 is a case related to headaches, faculty members who develop the case and the simulation team identify the most pertinent history-taking questions that should be asked of this headache patient. If the student asks a question that appears on the checklist, he or she receives 1 point for it. If the student does not ask that question during the encounter, 0 points are awarded. If the history-taking checklist for this sample case has 12 items on it, and the student receives credit for correctly asking 10 of those items, the score would be 83.33 for the history-taking section of this case. The same thing occurs for each standardized patient that students encounter, no matter how many stations the OSCE has. For example, if the OSCE has 4 cases and the student gets 10 out of 12 on case 1, 8 out of 10 on case 2, 15 of 15 on case 3, and 10 of 15 on case 4, the history domain score will be 43 points out of 52 possible items, for a history domain score of 82.69% on the entire OSCE. The same domain scoring calculation process is used on the interpersonal skills and the physical examination domains. Standardized patients undergo rigorous training with the simulation team to ensure that they understand the techniques that they are scoring. They score students on whether students correctly perform examination skills listed on the checklist during the encounter. Be aware that some cases may not have a physical exam component to them and therefore play no part in the PE domain score. In the interpersonal skills domain, a standard checklist is used for all encounters and cases at CMSRU. Faculty members grade the note writing data gathering component on a scale of 1 to 9, with 9 being the highest possible score a student can receive on global assessment of this domain. The score is then converted in the same way other 9-point scale scores are converted at CMSRU, using the following regression equation: the average score of 1 through 9 times 5 plus 55 equals a final score. At the end of the scoring process, the 4 domains are averaged together to arrive at a final summative OSCE score for the M3 year and weighted accordingly in the M1 and M2 years. More information about the M1 and M2 weightings will be provided by the course director in those years. Students must receive at least 60% on each domain to pass the OSCE. CMSRU considers this minimal competency, and again, this mirrors the way USMLE Step 2 clinical skills examinations are scored. Less than 60% on any domain score would equate to an unsuccessful OSCE. To review, this M2 student scored higher than 60% in all domains. The final score is above 60%. This student successfully passed the OSCE. Even though this M2 student had a total score of 81.54, the PE score was below 60%. Remember, students must receive 60% or higher in each domain. Because the PE score was below 60%, this student was unsuccessful in the OSCE. For feedback purposes, students receive history taking, physical exam, interpersonal skills, and note gathering scores for each individual encounter or case. These are not the final grade. The average domain scores previously mentioned are what counts toward the final grade. If you have any procedural questions regarding SP encounters or OSCEs, please contact the SimCenter staff. If you have questions about scoring, please email the Director of Assessment, Matt Gentili, at the email address shown here.